I'm Dr. Michael Harrison, and today I want to share something that could make a real difference in your life. In my 40 years of practicing medicine, I've seen thousands of patients walk through my doors. Some came in for routine checkups, others came in after something went terribly wrong. And I'll tell you this honestly, the ones that haunt me most are the patients who came in after a stroke that might have been prevented. Now, before we dive in, I want to be clear. While I'm a physician sharing evidence-based information, this video is for educational purposes only. It's not a substitute for personalized medical advice from your own doctor, who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let's get into it. Here's what I've learned after 4 decades of medicine. The habits that cause the most damage are rarely the obvious ones. It's not the big dramatic choices that get us. It's the small, invisible routines we repeat night after night, year after year, without ever questioning them. And there's one particular category of nighttime habits that I've seen contribute to cardiovascular problems more than almost anything else. These are the habits you do in the hours before bed and during sleep itself. Today I'm going to walk you through 5 critical nighttime factors that affect your heart and brain health after age 50. We'll start with number 5 and work our way to number 1, which might just change everything you thought you knew about protecting yourself while you sleep. I understand how overwhelming health information can be. Every week there's a new study, a new warning, a new thing you're supposed to worry about. So let me promise you this. I'm going to explain this the same way I explain it to my own family members. No fear tactics, no exaggeration, just honest, practical guidance based on what the research actually shows and what I've seen with my own eyes in over 40 years of treating patients. Stay with me through all 5 points because each one builds on the last. And by the end, you'll have a complete picture of how to protect your heart and brain during the most vulnerable hours of your day. Let me start with a story that illustrates why this matters so much. I want to tell you about someone I'll call Eleanor. Eleanor was 68 years old, a retired school teacher, grandmother of 4, and the kind of person who took pride in taking care of herself. She walked every morning, watched what she ate, and never missed a doctor's appointment. Eleanor came to see me because she'd been experiencing occasional dizziness in the mornings and didn't understand why. Eleanor told me something I'll never forget. She said, "Dr. Harrison, I do everything right. I exercise, I take my medications, I even drink a big glass of water every night before bed because I read it's good for you." That fear of not doing enough, of missing something obvious, I hear it almost every day. And the truth is, Eleanor had reason to be concerned. But the cause wasn't what she expected. What we discovered together was that several of her nighttime habits she thought were healthy, were actually working against her cardiovascular system. And this is exactly why I'm making this video today. Because what you don't know can hurt you. But what you do know can protect you. Now here's the part most people miss. Your body doesn't behave the same way at night as it does during the day. The cardiovascular system goes through profound changes when you sleep. Your heart rate slows, your blood pressure drops, your blood vessels relax, and your brain enters a completely different mode of operation. For younger people, these nighttime shifts happen smoothly. The body compensates, everything adjusts. But after 50, and especially after 65, these transitions become more challenging. The blood vessels that once flexed and adapted with ease have stiffened over time. Regulatory systems that kept everything in balance have become less responsive, and habits that might be perfectly fine during the day can put unexpected stress on an aging cardiovascular system at night. According to the American Heart Association, nearly 75% of strokes occur in people over the age of 65. And research from the Framingham Heart Study, one of the longest-running cardiovascular studies in the world, found that stroke risk roughly doubles with each decade after 55. This isn't meant to scare you, it's meant to inform you, because when you understand the risks, you can take meaningful steps to reduce them. Let me break down exactly what happens inside your body while you sleep. When you lie down, gravity stops helping your blood return to your heart the way it does when you're upright. Fluid redistributes throughout your body, your autonomic nervous system shifts into recovery mode. And if everything is working well, your brain activates what researchers call the glymphatic system, a kind of internal cleaning crew that removes toxins and metabolic waste that accumulated during the day. This nightly cleanup process is crucial for long-term brain health. But here's what the research shows. This system only operates effectively during deep, uninterrupted sleep. And when your sleep is fragmented, when you're waking up multiple times, when your blood pressure is swinging up and down, this cleansing process gets disrupted. Over time, that matters. So now let's get into the 5 nighttime factors that affect your heart and brain health. Remember, we're counting down from 5 to 1, saving the most important for last. Number 5 is your bedroom environment. And I know that might sound surprising. Many seniors I've worked with meticulously manage their medications, monitor their blood pressure, and follow their doctor's orders, but completely overlook the environment they sleep in every night. What if your room's temperature, your lighting choices, even the electronics near your bed were quietly working against your cardiovascular system while you sleep? Let's start with temperature. Most seniors think that keeping the room toasty is safer. After all, cold feet and stiff joints are no fun. But here's what the science actually shows. Research published in The Lancet found that cardiovascular incidents, including strokes, were associated with extremes in nighttime temperature, particularly when the body struggled to regulate its internal thermostat. Here's why this matters. Cold environments cause blood vessels to constrict. For seniors with already stiffened arteries, that vasoconstriction can contribute to blood pressure spikes during sleep. But overly warm environments aren't the answer either. They can lead to dehydration, poor sleep quality, and their own set of cardiovascular stresses. The research suggests that a bedroom temperature between 60 and 67 degrees Fahrenheit, that's roughly 15 to 19 Celsius, promotes the deepest, most restorative sleep. This cooler environment helps reduce nighttime blood pressure variability, supports a lower resting heart rate, and may help reduce inflammation markers. Now let's talk about light, specifically blue light from screens. Many seniors use tablets or watch television before bed. Some even fall asleep with the screen on. But blue light from these devices suppresses melatonin, the hormone that regulates your sleep-wake cycle. When melatonin production drops, your sleep becomes lighter, shorter, and more fragmented. But here's the deeper issue that most people don't understand. Melatonin isn't just about feeling sleepy. A study published in Oxidative Medicine and Cellular Longevity found that melatonin has neuroprotective and antioxidant properties that help protect blood vessels. By suppressing melatonin through blue light exposure, you may actually be reducing your brain's natural protective mechanisms while you sleep. Here's what you can do. Consider installing blue light filters on your devices if you must use them in the evening. Try to stop screen exposure at least 1 hour before bed. Use warm amber-colored bedside lamps after sunset, and avoid bright overhead lighting at night, which can stimulate alertness when you're trying to wind down. I've seen so many patients who made these simple environmental changes and noticed improvements within just a few weeks. Better sleep, more energy in the morning. And those morning headaches or dizzy spells they'd been experiencing started to fade. Now let's move to number 4, which builds directly on what we just covered. Number 4 is your sleep position. And this is something I see patients get wrong all the time. You might think of sleep as the safest time of the day, but for seniors, the position in which you sleep can make a meaningful difference in how well your cardiovascular system functions during those crucial nighttime hours. When you lie down, your body enters a state of autonomic regulation. Your heart rate slows, your blood pressure drops, your breathing becomes shallower. This is your body's way of conserving energy and recovering from the day. But for individuals over 65, this shift also puts additional demands on circulation, especially blood flow to and from the brain. Research published in the Journal of Stroke and Cerebrovascular Diseases found that sleeping in a completely flat position was associated with increased risk of nighttime cardiovascular events in older adults, particularly those with underlying hypertension or vascular inflammation. Why does this happen? When you lie completely flat, the venous drainage from your brain slows down. Gravity is no longer helping blood return efficiently to your heart. For younger individuals, the body compensates easily, but for seniors whose blood vessels may have lost some of their flexibility, this can result in pressure changes that stress the cardiovascular system. And if you suffer from sleep apnea or snoring, the concern becomes even more relevant. Lying flat can narrow the airway, leading to interrupted breathing, reduced oxygen levels, and frequent micro-awakenings. This creates what I call a roller coaster effect on blood pressure, dipping low, then surging high, over and over throughout the night. Research from the American Stroke Association suggests that sleep apnea may increase cardiovascular risk by up to 4 times in older adults. So what's the alternative? Based on what I've seen clinically and what the research supports, I recommend what some doctors call gravity-assisted sleeping. This simply means elevating your head and upper torso by 10 to 30 degrees using a wedge pillow or an adjustable mattress. This modest incline helps enhance blood return from the brain, reduces pressure on the neck and airway, and may help lower the intensity of nighttime blood pressure swings. And if you suffer from acid reflux or nasal congestion, you'll likely notice improvements there too. Side sleeping, particularly on the left side, has also shown benefits in some research. A study in the Journal of Neuroscience suggested that this position may support better drainage through the lymphatic system, that brain cleaning process I mentioned earlier. This is exactly what happened with a patient I'll call Robert. Robert was 72, a retired engineer who prided himself on solving problems. He came to me complaining of morning headaches and fatigue despite sleeping 7 or 8 hours every night. His wife mentioned he snored heavily. We worked together on a simple adjustment. Robert started sleeping with his upper body elevated about 15 degrees using a foam wedge. Within 2 weeks, his wife reported his snoring had decreased significantly. Within a month, Robert told me his morning headaches were almost completely gone. He said, "Dr. Harrison, I feel like I'm actually resting now instead of just lying in bed." Now, I'm not suggesting Robert's story means you'll have the exact same experience. Everyone's different. But his story illustrates how a small positional adjustment can sometimes make a meaningful difference. Alright, stay with me here. We're about to get to the really practical stuff, but I want to make sure you caught everything we just covered. So far we've talked about your bedroom environment and your sleep position. Both of these factors influence how well your cardiovascular system functions during the night. Now we're going to move into the 3 remaining factors, and pay close attention because these involve things you might be doing every single day without realizing their potential impact. Number 3 is something that might surprise you. It's your nighttime hydration habits. Now I know what you might be thinking. Hydration is essential. Every part of your body, from your joints to your brain, depends on water, and you're absolutely right. But what most people don't realize is that the timing of that hydration, especially in the hours before sleep, can carry unexpected consequences for aging bodies. Here's what I tell my patients. When you drink a full glass of water right before bed, your kidneys immediately go to work. Your bladder fills, and at some point during the night, your body sends you a signal: you need to get up. For younger people, this might just be an inconvenience, but for older adults, this is where some real concerns can emerge. Nocturnal waking, especially standing suddenly from bed in a dark room, can cause sharp drops in blood pressure. This phenomenon, called orthostatic hypotension, temporarily reduces blood flow to the brain. A study published in Neurology found that nighttime blood pressure fluctuations and sudden drops were associated with a 33% increase in cardiovascular events in individuals over 65. And it wasn't just the waking itself, it was the disturbed sleep cycles, the fragmented deep sleep, and the rebound surges in blood pressure afterward that stressed the cardiovascular system. I want to pause here and remind you, I'm not suggesting you stop drinking water at night entirely. What I'm sharing today may inform a conversation with your doctor, but any changes to your hydration routine should be made thoughtfully and in consultation with your healthcare provider. That said, here are 3 hydration guidelines I've given my patients for years to help protect their heart and brain health overnight. First, consider finishing your main fluid intake about 90 minutes before bed. The key is giving your kidneys enough time to process the water before you lie down. According to a study in the Journal of Clinical Sleep Medicine, individuals who stopped drinking fluids 1.5 to 2 hours before bed experienced significantly fewer nocturnal awakenings than those who continued hydrating right up to bedtime. Second, front-load your hydration in the morning and afternoon. Your body's ability to absorb and utilize water is highest when you're active. Think of your hydration like a savings account. You want to deposit early so you're not scrambling at night. According to the Mayo Clinic, seniors should aim for about 7 to 9 cups of fluid per day from all sources, but the bulk of that should ideally come before the evening hours. Third, consider what you're drinking, not just how much. Some fluids are more likely to disrupt sleep than others. Sugary drinks can spike insulin and disrupt sleep quality. Caffeinated beverages can act as diuretics and trigger overnight dehydration. And alcohol, while it might make you sleepy initially, can dilate blood vessels and contribute to nighttime blood pressure instability. If you take medications with water at bedtime, speak with your doctor about whether it might be possible to shift them earlier when appropriate. This brings us to number 2, and pay close attention here, because this one can genuinely catch people off guard. Number 2 is nighttime medication and supplement combinations. Your doctor gave you a prescription. Your pharmacist handed you a bottle. Maybe your neighbor or a health article recommended a supplement. So like millions of seniors, you follow the routine, a handful of pills before bed. You're being responsible, you're taking care of yourself. But here's something I wish more patients understood. Some bedtime combinations may create interactions that affect blood pressure control, sleep quality, and overall cardiovascular function. And because these effects happen gradually, and while you're asleep, most people never connect the dots. Now, I want to be very clear about something. I'm not suggesting you change any medications without speaking to your prescribing physician. What I'm sharing today may inform a conversation with your doctor, but any changes should only be made under their guidance. Let me share a few examples of combinations that have raised concerns in the medical literature. First, taking certain blood pressure medications together with diuretics at night. Some seniors take their blood pressure medications or diuretics before bed, thinking the timing doesn't matter. But research suggests that this combination taken at night may sometimes cause blood pressure to drop too low during sleep, a phenomenon called nocturnal hypotension. In older adults, this may reduce oxygen delivery to the brain during the early morning hours when cardiovascular events are most likely to occur. If you take these medications at night, it might be worth asking your doctor whether shifting the timing could be appropriate for your situation. Second, sleep aids combined with antihistamines. It seems innocent enough, a sleeping pill and something for allergies. But some research suggests this combination can suppress the central nervous system, slow breathing, and may contribute to reduced oxygen levels during sleep, especially in older adults who may have undiagnosed sleep apnea. Third, blood thinners combined with omega-3 supplements or turmeric. You're trying to be healthy. You take your prescribed blood thinner for heart health and add an omega-3 or turmeric supplement for inflammation. But here's what many people don't realize. Both omega-3 fatty acids and turmeric have their own blood-thinning effects. When combined with prescription anticoagulants, they may tip your body's clotting balance in ways that increase bleeding risk. A meta-analysis published in the Journal of Thrombosis and Hemostasis noted that supplement plus anticoagulant combinations are widely underreported and often misunderstood by patients who believe natural means safe. Fourth, statins combined with grapefruit products. You may have heard that grapefruit juice interferes with certain cholesterol medications. Grapefruit blocks an enzyme in your liver that helps break down statins. When statins don't metabolize properly, they can build up in the bloodstream, potentially leading to muscle problems and other complications. This is exactly why I encourage every patient to have a complete medication review with their doctor and pharmacist at least once a year. Bring everything. Prescriptions, over-the-counter medications, vitamins, supplements, everything. Let the professionals look at the complete picture. This reminds me of one of the most meaningful conversations I've ever had with a patient. Let me tell you about a man I'll call William. William was 74, a retired postal worker, and one of the most meticulous people I've ever met. He kept detailed records of everything, his blood pressure readings, his walking distances, even what he ate for every meal. William came to see me because he'd been experiencing strange symptoms, occasional dizziness, some confusion in the mornings. He couldn't understand why because he was doing everything by the book. When we went through his complete medication and supplement list, we found the problem. William was taking a blood thinner prescribed by his cardiologist, plus fish oil and vitamin E for heart health, plus turmeric for joint inflammation, plus a baby aspirin because he'd read it was good for seniors. Every single one of these has blood-thinning properties. Together, they were creating an effect far stronger than any of them individually. We worked with his cardiologist to simplify his regimen. Within a few weeks, his symptoms had resolved. William told me I thought I was being careful. I didn't realize being careful meant looking at the whole picture, not just each piece separately. And remember, this information is meant to educate and empower you, not replace the advice of your physician. Take what you've learned today and have a conversation with your doctor about what's right for you. We're getting to the most important point now. Everything I've shared so far leads up to this final factor. Number one is what I call the protective nighttime routine. This is about taking everything we've discussed and turning it into a simple, consistent practice that actively supports your heart and brain while you sleep. Imagine ending each day not with anxiety or discomfort, but with a quiet, calming ritual that actively works to protect your cardiovascular system. This is exactly what some of the best stroke rehabilitation clinics around the world are now teaching their patients. These 3 bedtime habits are adapted from what I've seen used in clinical settings, and they're simple, effective, and supported by research. The first habit is what I call the neurological wind down. This involves gentle neck and shoulder mobilization before you even get into bed. Spend about 5 minutes activating and calming the vagus nerve, which is your body's main pathway for relaxation and blood flow regulation. How do you do this? Begin with slow circular movements of your shoulders, about 10 rotations in each direction. Follow with gentle neck tilts from side to side and small chin-to-chest stretches. According to a study published in Frontiers in Neurology, this type of mild mobilization before bed was associated with reduced nighttime blood pressure variability in adults over 65. This isn't about working out or stretching intensely, it's about priming your nervous system for deep restorative sleep. Pair these gentle movements with deep nasal breathing. Inhale for a count of 4, exhale for a count of 6. This breathing pattern has been shown to help lower heart rate and support blood pressure regulation. The second habit is what I call the circulation reset. This involves a simple legs up position that helps reverse the effects of gravity after a full day of standing and walking. Here's how it works. Lie on your bed and place your legs either up against a wall or over a stack of pillows so that they're slightly above heart level. Hold this position for 5 to 10 minutes. What does this accomplish? It helps reduce fluid that has pooled in your legs during the day, encourages lymphatic drainage, and gives your heart and brain a break from pressure. A small trial published in the Journal of Geriatric Cardiology found that seniors who performed this passive position nightly showed better morning blood pressure regulation and fewer leg cramps after just 2 weeks. If you can't elevate your legs against a wall comfortably, don't worry, a few firm pillows under your calves will work just as well. The third habit is what I call the sleep anchor. This involves creating a consistent sensory cue that signals to your brain that it's time to transition into sleep mode. This could be a specific scent, like lavender or chamomile. It could be a 5-minute soundscape, like ocean waves or gentle white noise. It could even be a small physical ritual, like applying a calming lotion to your hands or feet. The point is to anchor the act of going to bed to a repeated sensory signal. Over time, this forms a neural association. Your body recognizes the signal, begins releasing melatonin, and naturally slows down your systems in preparation for sleep. Your cue doesn't have to be fancy or expensive, it just has to be consistent. The same scent, the same sound, the same simple ritual, every single night. Together, these 3 practices form what I think of as a protective triangle. Mobilize the body, redirect circulation, trigger sleep naturally. When done consistently, they don't just improve sleep quality, they create a supportive environment for your cardiovascular system during its most vulnerable hours. Before I let you go, I want to share one more story that I hope will stay with you. I want to tell you about someone I'll call Margaret. When Margaret first came to me, she was convinced there was nothing she could do to improve her situation. She was 71, recently widowed, and struggling with sleep problems, morning fatigue, and a general sense that her body was failing her. Here's what we did together. And notice I say together, because this wasn't me telling Margaret what to do, it was us working as a team to find solutions that fit her life. First, we reviewed her complete medication and supplement list, and worked with her other doctors to simplify it. Second, we adjusted her bedroom environment, lowering the temperature and removing the television she'd been falling asleep to. Third, we shifted her hydration to earlier in the day. Fourth, we elevated the head of her bed slightly. And fifth, we established a simple bedtime routine with gentle stretches and a lavender scent she loved. 3 months later, Margaret came into my office and the first thing she said was, "Dr. Harrison, I feel like myself again. I wake up rested. I have energy to play with my grandchildren. I'm not scared anymore." I'm not telling you Margaret's story to promise that you'll have the exact same results. Everyone's different. But what Margaret's story shows is that improvement is possible. Even when you feel like you're heading down a path you can't change, there are specific evidence-based steps that can shift that trajectory. Let me bring together everything we've covered today. We talked about 5 nighttime factors that affect your heart and brain health after age 50. Number 5 was your bedroom environment. Temperature, lighting, and the presence of electronics all influence sleep quality and cardiovascular function. A cooler room, reduced blue light exposure, and a calm sleeping space support your body's natural recovery processes. Number 4 was your sleep position. Lying completely flat may put additional stress on blood flow to and from the brain, especially in older adults. Modest elevation of your head and upper body can help reduce this stress and support better sleep quality. Number 3 was your nighttime hydration timing. Drinking large amounts of fluid right before bed can lead to sleep fragmentation, sudden nighttime blood pressure changes, and other effects that stress the cardiovascular system. Shifting hydration earlier in the day may help. Number 2 was medication and supplement combinations. Some combinations taken before bed may have interactive effects that influence blood pressure, bleeding risk, and sleep quality. A complete medication review with your doctor and pharmacist is essential. And number 1 was establishing a protective nighttime routine. Gentle movement, circulation support, and consistent sleep cues can help prepare your body for deep restorative sleep and support cardiovascular function throughout the night. These changes aren't dramatic. They don't require expensive equipment or complete lifestyle overhauls, but implemented consistently, they can make a meaningful difference in how well your cardiovascular system functions during the most vulnerable hours of your day. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you've learned today and have a conversation with your doctor about what's right for you. If you found this helpful, if you learned something today that you can use, I'd really appreciate it if you hit that subscribe button. I release new videos every week specifically designed to help you understand your health in a way that actually makes sense. And I promise to always give you the science without the hype, the practical guidance without the fear tactics. Drop a comment below and tell me which of these nighttime factors are you going to address first. I personally read every comment, and I'd love to hear from you. If you know someone who might benefit from this information, a spouse, a parent, a friend, please consider sharing this video with them. You might be giving them information their doctor never had enough time to explain. Here's what I know after 40 years of medicine. Your body has an incredible capacity to heal and protect itself when you give it the right support. Sleep isn't just rest, it's recovery, it's repair, it's protection, and the habits you practice in the hours before bed and during sleep itself can either support that process or work against it. You have more control than you might think. Not over everything, but over enough. Over your environment, over your routines, over the timing of when you hydrate and take your medications, over whether you consult with your doctor about potential interactions, over whether you invest a few minutes each night in preparing your body for the restorative sleep it deserves. These choices matter. They add up, and over time they can make a real difference in how you feel, how you function, and how well your heart and brain are protected during those quiet nighttime hours. Take care of yourself. I'm rooting for you, and until next time, be well.